Hi, and welcome back to the Long-Term Forecast. I'm Dr. Denise Milne, Executive Director of the Alberta Continuing Care Association. Thank you for tuning in to today's very important discussion on the Continuing Care Roadmap for Technology Innovation. Before we begin, I'd like to thank today's sponsor and a proud partner of ACCA, PointClickCare. Driven by a commitment to advancing interoperability in healthcare and making a meaningful impact on the lives of millions, PointClickCare is solutioning real-world problems to mend a fragmented care system to enable faster, better decision-making and improve clinical outcomes. Visit www.pointclickcare.com to learn more. It is now my pleasure to introduce today's guests, Steve Kovacic and Marlene Raasok. Steve is the Vice Chair of ACCA and the Vice President and Chief Innovation Officer at the Good Samaritan Society, where he leads key portfolios including innovation, technology, analytics, and strategic operations. With over 20 years in healthcare leadership and a background in the energy sector, he brings a unique blend of public and private sector expertise to senior care. Steve actively contributes to government and industry task force and is a frequent speaker on technology, workforce innovation, and leadership. Through his roles with the CPHR Alberta and ACCA, he champions best practices in senior care across Canada. Marlene is a retired healthcare and post-secondary education leader with experience across Alberta, British Columbia, Saskatchewan, and Ontario. She is known for driving innovation to improve operational outcomes and financial sustainability in continuing care and education. Marlene currently chairs the board of the Good Samaritan Society and leads the Future Policies Forum with the Alberta Association on Gerontology. She was recently honored with the Mary Morrison Lifetime Achievement Award for her contributions to gerontology. A dedicated advocate and a family caregiver, Marlene brings a lifelong passion for enhancing quality of life for older adults. And with that, let's begin our discussion on the Continuing Care Roadmap for Technology Innovation. So, Steve, as a board member of the Alberta Continuing Care Association, or ACCA, can you share with us the role that ACCA can contribute to our involvement in the IT Roadmap Partnership?
Great question, Denise. Thank you. And the answer really is two words: operator engagement. For years, operators have always been indicating the need to continue enhancing our IT infrastructure. But right now, we're limited in the environment around us. Further increasing the issue is that the world is quickly changing. Healthcare and continuing care is becoming more and more reliant on hardware and software subscriptions. We could even have a whole topic right now on artificial intelligence and where healthcare is quickly going. But right now, we are still putting in place the building blocks, the technology foundation. Continuing and community care are playing catch up, and this initiative we know will provide the plan to get us there. Through the ACCA and our three-party arrangement with our partners, the Alberta Association on Gerontology and Alberta Innovates, we believe we will support the engagement of operators throughout our province so our voices are heard as we develop a 3-year IT roadmap for continuing and community care. Personally, I'm excited, as this has often been discussed, even identified in the facility-based continuing care review, where IT has highlighted as an opportunity. But to date, there's been little action. Now it's time to steal a line from Elvis Presley. It's now time for a little less talk and a lot more action.
Love it. So, Marlene, in terms of the Alberta Association of Gerontology and Alberta Innovates, who are key partners in this initiative, can you expand on what Steve has said and take it a bit further with the IT roadmap?
You bet. I'm really pleased to be here. AAG has been around since 1975. Not me, but the organization. And we have been focused on the ends of well-being for older adults through knowledge development, expertise, and insight that come together, and policy advocacy. So our role in this is two strategies: cross-sector knowledge mobilization and practice development. We work across sectors: community-based services, community and continuing care, educators, acute care, and that is a key platform to achieve the goals of the Alberta Health revisioning for an integrated health system. But it's not just knowledge mobilization, it's also knowledge to action. So it's knowledge mobilization and facilitating practice development. That requires the second piece of our work, and that's policy advocacy. There's small policy in terms of some of the actions required to enable operators to make and sustain ITIM services for today and the future. And there's larger policy that links across sectors. Now, that's where Alberta Innovates is a very important partner. They're well positioned in Alberta as the innovation engine for IMIT, digital and technology adoption, development and adoption. We're talking now more about adoption in smart ways. But the whole aspect of interoperability, they are the authors, chairs of some of the work around interoperability saves lives. Well, to the Alberta Health Systems refocusing, interoperability not only saves lives, it is fundamental to the goals of an integrated system. We need them and their connections for that locally, provincially, and nationally. Also, the whole aspect of data privacy. How can we share information if we can't share information? Well, the current legislation for privacy of information in Alberta is under review, and they are a key partner in that. So together, we want to work to create that 3-year roadmap.
So, Marlene and Steve, similar to when we were at the ACCA conference and, it was described to us that Minister LaGrange, Minister of Health, is the architect, and that the engineers were Minister Nixon and Minister Williams. Is it fair to say that Alberta Innovates, who's not here today, unfortunately, is kind of like the architect, the kind of the brain behind the IT roadmap, and AAG and ACCA play the role in trying to lay it out so that we can really advance the continuing care sector with technology?
I might not, sorry, Steve.
No, please,
I might not say they're the brains because the brains are everyone who's going to be involved in this, because we're going to co-develop that, and we'll talk more about, Steve can lay out the phases of our work, because we're going to tap into the brains on the ground, what we're doing, what we need, and how to move forward in a sustainable way. But they are definitely an anchor player.
Yes.
And they have contributed finances to that end. And obviously, they have a powerhouse of resources to that end. Steve?
I would agree with you, Marlene. I think they're a key player in the conversation. And as we had initial dialogue about where we wanted to go, we all felt we played a key role. We were all collaborators in where we wanted to make sure this initiative was taking us. And we all are bringing expertise to the table. AAG, ACCA, and AI. So I think that as this closely knit partnership, I think we can achieve more results rather than just one particular anchor. And Marlene clearly articulated, AI is bringing the coalition behind them with regards to the industry technology that they can bring to the table.
Okay, that's fantastic. I love how that was explained. So thank you for that. So can one of you give us a little history of how this IT roadmap even came into a concept?
Well, it wasn't on a napkin, but it was on a whiteboard. AAG and ACCA had a conversation about, AAG has talked to 1,400 people with our webinars, and it was very clear as we learned from those webinars, we can make a difference. We need to make a difference. That's what the experts were saying. That's what the participants were saying. We can make a difference in how we deliver services and the environment for the workforce. We need to put that knowledge, those desires into action. And then, Steve, you can talk. We had a session at ACCA's conference, and you can speak to that. And so we brought all these together on the whiteboard to develop what today has become the 3-year roadmap with Alberta Innovates.
Yeah,
Steve.
and to expand upon that at the ACCA conference, and again, as Marlene outlined as well too, the three parties got together and said, you know what, there's an opportunity here. And as I discussed earlier, we knew that the facility-based continuing care review often talked about the power of IT, but we wanted to hear it directly from our members, the membership within ACCA. So at the ACCA conference, a panel was developed that had AI, Alberta Innovates, ACCA, AAG, and Marlene, who was the other party?
H-Tech.
H-Tech was with us as well too. And we had a great conversation of not just where we are currently, but where we want to go. But we also want to ask members, why are there roadblocks currently in place that are not allowing us to get to where we're getting to, where we want to go? So they provided real-time feedback to us that allowed us to collect this information and incorporate it into the development of our strategy that is allowing us to create the IT roadmap. So again, as I think you can hear throughout this whole conversation today, it really is about listening to the voices of members, listening to the voices of operators, and saying, we know where we are today, but we need to get to the future, and how can we listen to you to develop the plan to present to government to get to that area?
So our roadmap has a number of phases, and we're hoping to begin that this fall. It's hard to believe it's April coming up. So we are hiring a project resource to help us with that. But the first is a current state analysis. That is formally talking with people, surveying the scene in Alberta. What's happening? We already have a number of initiatives and proof of concept. We also have needs. For example, the funding formulas were not imagined with the view of the IMIT cybersecurity technology world that we're in and must be in. So we want to get that current state analysis to then create an opportunity assessment that we can then move. Some of it will be gaps where we're not doing anything. Some of it will be opportunities to build on the initiatives we have. We actually have a number of new service delivery initiatives funded in Alberta, which could actually be even better with a technology innovation underpinning. And we haven't had the focus and maybe the resources to do that, to really optimize them. So opportunity analysis and an action plan, number 2. The third is building that into a 3-year strategy that looks at sustainable investment and return on investment. There's got to be investment along the way, but how that is done and tied to new innovation in funding, innovation in practice has yet to be developed. And then concurrent with that, there's this theme of creating winning conditions for the technology implementation and its opportunity. And it's in the 3-year development phase. One is internet access across the province.
Yep.
And other is the privacy work that I talked about. And other is looking at the implications for interoperability of systems that people talk about connecting various services and people across the province. So at the end of this, we will have proof of concept initiatives that are tied to a system focus of learning and policy exemplars, as well as ongoing plans for action.
So I love your vision. I'm just going to be really clear about that because I think it's so needed, particularly with all the transformation that's happening in Alberta, and then the opportunity to take the continuing care pillar or assisted living Alberta pillar and link it to acute care, mental health and addictions, primary care, because that piece has been absolutely missing.
Agreed.
So can you speak a little bit about like what that would do for operators, care providers when you get not just the internal links happening, from home care to facility base, but also to the larger system. What an opportunity.
I'll jump in there with regards to, because one of the things that we were very thoughtful of when we were designing this IT roadmap strategy and making sure we're moving forward with it is we looked at the current health system refocusing strategies and the outcomes that they're trying to achieve as well too. We didn't want to be we wanted to be parallel to where the government was going, so that when we presented this at the end of the day, this was clearly in alignment with what government has been looking at during the refocus. So we are confident right now that we're actually having 5 key objectives that will, again, align to the government's intentions of where they want to go. And one of those things, and there's 5, is optimize innovation and technology to enhance impact and cost effectiveness of the health system. 2 is employ priority digital systems with, as Marlene indicated, interoperability in the health system. 3 is identify new technologies and digital systems that enhance the work environments for staff and care partners. This is a key one to talk about as well too. Not just in Alberta, but globally, we're seeing a health human resource crisis. And it's clearly identified that through the right technology, we can optimize how we actually provide care and leverage and support our employees. So let's see how we can actually implement this to support. 4 is consider the breadth and variability of services across both rural and urban centers and both small and large organizations. We can't forget, as Marlene had indicated as well too, that Wi-Fi capabilities may be, or not just Wi-Fi capabilities, but internet capabilities may be limited in key areas in the province. So therefore, we want to be cognizant that this plan will include all breadths of areas within the health system, small and large, and urban and rural. And 5, ultimately, just like everybody else is looking for, is ensure the sustainability of infrastructure for IT and service delivery. We know when we developed this IT roadmap that we were confident that at the end of the day, when we present this to government, this will hit all the check marks that they're looking for from the refocus.
Just to build on one point that Steve mentioned, if you haven't already looked at the Alberta Health Workforce Plan as of December 24, the 5th pillar there, their strategic focus area, and I'm reading, to innovate and evolve, empower healthcare professionals to work to their full scope of practice, full capability within a team-based environment. How do you connect? We need to connect teams to do that. Yes. To better meet population needs and also to connect with people and system demands. This may include leveraging technologies and information systems to connect health workers to collaborate, not only to connect health workers, but to change the work environment within which they work.
Absolutely.
So this is fabulous work. Fabulous work. It's a fabulous collaboration. Marlene, ACCA is a fan of AAG and AI.
Goes both ways.
Yeah. And this is a really neat partnership, right? So let's talk about the next steps. You're going to hire a project person to oversee, then what?
Go ahead,
How
Steve.
is this going to we want success.
Yep.
We have to have a lot of quick wins, just given the movement of government and all the change that's happening. How do we envision this, connect?
That's a great, and again, in many ways, this will be like the traditional strategy, but I'm going to put a little bit of a twist on this because we are very, again, thoughtful about how we want to ensure we're including engagement. Marlene talked about the fact that we will conduct that current and future state analysis. We'll be looking at opportunities across the system, and we're going to make sure we have proper engagement. Now, one of the things that has been clearly identified in our plan is what we're calling the Engagement Action Council. Again, action is a key word you're seeing time and time again here, and as is engagement and collaboration. Marlene indicated throughout this conversation that there are already great initiatives occurring across the province of Alberta. In many ways, this is an open tent conversation. We recognize that we can engage with these leading experts in the province to say, what have you learned through your initiatives, and how can we capture that in the IT roadmap for the province of Alberta? So it's through this Engagement Action Council that we'll be able to collect this information and, again, coalesce it as part of our strategy so that we can drive it forward. It's going to be imperative that people provide their voices and operators provide their voices so that we are able to fairly and accurately create a plan that really will be meaningful to operators in the province.
You know what? The cool part here, Steve and Marlene, is you're building on past opportunities or past achievements, and you're laddering it. So it's not like people have to start from scratch. It's like there are things in place. Let's build on that. Let's learn from that. But what are the gaps? And let's identify them. And let's put a whole system together that's going to best support the continuing care sector, which will then link to the other pillars. Like, I think this is just fabulous work. Like, it's timely, it's needed. And I know you guys have been working hard on this for the past while, but like you can see it, this vision happening now, which is super exciting.
Yes, it will end up in a document. We'll have a piece of paper, many pieces of paper. But the other piece that's actually more important is in that piece of paper will be actions that are underway. We're not waiting.
Yeah.
We will, and that'll be some of the art in this, to find the best way to mobilize on the ground now some of the opportunities that we have, to talk expressly about the enablers, or I could use the barriers issue that's holding us back, because there are parallel initiatives on funding models, etc. Well, we can be helpful to those by giving some of the perspectives that are so important for the technology enablement. So there's a back and forth linking between other initiatives underway in the province that we can think of. I'll give another example. The Minister of Health has talked about Connect Care coming to everyone. Well, there's a conversation about that, for whom and in what way. So you can imagine that there will be a series of parallel initiatives in the opportunity section that come out of that first state of the nation to actually explore and inform. And action will be over here. But the key thing about the Engagement Action Council, we will know about those key systemic changes.
Yeah.
And we can be linking them and tracking the progress and the learning. And also, when I think about AAG's role and ACCA, this example, the podcast, is an example of getting information out. If you look at AAG's most recent AgMag, there will be a series on technology innovation there for the next 6 months, because we are bringing chapters of a book. So we are exploring together, we're learning together, and we're moving.
Can I add on that? Because I think Marlene touched on a very important part here as well, too. It's the burning platform. It feels like IT has always been beneath. It's like most people don't see it's the wires, the technology behind the walls. But one of the things that Marlene had touched upon as well, too, is the good work that AAG is doing with regards to making sure that the conversations like this in the podcast and in their own forums, that this continues to be a topic of conversation. We did the same thing at the ACCA conference, where we made this a topic of conversation. The intention here is, and through these three parties, and I know that there's a lot of key stakeholders involved, it's going to be keeping the burning platform front and center. We will continue to have conversations, and this won't be just behind the scenes again. We want to make sure that this continues to be a topic, that it's not forgotten about. There's a lot of things that are happening right now in the system refocus, but we truly believe that technology can be an enabler to support the refocus as well, too. So we want to ensure at the ACCA conferences, at the Alberta Innovates conferences, and at all of the events for AAG, IT and the services of IT continue to be a topic of conversation and where we are progressing in this IT roadmap.
And just to further that is to create the conversation on technology in the transition committee.
Agreed.
With the ministry, right? I think that's hugely important too, because this is a critical tool in the toolbox of staff. It's important to Albertans that information flow, about their care, right? Marlene talked about that at the beginning. Like, this is so vital, and you can feel the action that's about to happen. Yeah.
Alberta has stepped way out there with refocusing the health system. There was last week there was a global webinar from Deloitte, and it was from across the world. There are key consultants across the world, and they had surveyed healthcare leaders. And here were the top 3 trends. Imagine this. So this is the global environment. Maybe one day people will be talking about Alberta. So the global environment. The key trends, 3 of them. Number 1, digital technology with 3 actions. Modernize data and core technology. I think we're going to hear some of that. Migrate to the cloud. But what does that mean? And reinforce cybersecurity. And what does that mean? Those are very current issues for the current environment. So it's not just about moving over there, it is actually strengthening today. Number 2 key trend that's worrying leaders across the world, workforce. 3 major actions. Use technology to support the workforce, change their work environment, change the opportunities to connect, educate staff on new technology like AI and how technology will help them, not worry them. So that's another aspect coming, and support the health and well-being of the workforce in so many ways. Number 3, big trend, people's expectations for care. The top 3 areas that they are saying, because experience matters. So evaluate alternative sites for care and home care and wraparound services and all of that. But wraparound isn't a blanket. It'll be connections and the way we interact with technology. Work to use digital tools for the team management and also for individuals to engage and support their own care planning. And then process improvement in pathways. And technology will be a big piece of that. I think about falls prevention and the information we have to improve that. So I'm looking forward to telling the Alberta story on how we are enacting those key trends, and indeed we'll be able to do that.
So, Marlene and Steve, we have to come to an end. However, I think it's really important you come back for another podcast. As this initiative begins to roll in action, I really think the conversation, keeping the conversation going, letting people know, because these podcasts go everywhere, as you know. And I think it would be just really critical to do that. So I want to thank you both, Steve and Marlene, for joining me today and sharing your insights on this huge initiative. Obviously, your leadership and expertise is instrumental in driving this work forward, and we want to see you back. It's really important that, as you said, the conversation continues. We want to create that momentum. Obviously, you presented at our member meet, and that was really important. And there's a lot of other opportunities for the conversation. So to that end, we really think that strongly that if we could keep this going, it will drive the change that we're all looking for in Alberta and keep Alberta strong and as a leader in the field of continuing care. So to our listeners, please take a moment to leave us a review. Your support helps us spread the word about this important work. Thanks for tuning in, and we'll see you next time.